نور لي محمود محمود نور لي محمود نور لي.
معاك يا صبري خلاص.
واحد دي يا محمود بص لي كده.
ايه؟
بص لي كده واحد دي.
واحد بي
بس بقى ما تفضلش.
Ladies and gentlemen, it's a great pleasure to receive this elegant delegation from the Georgia and CDC to exchange experience in one of the major public health fields, which is prevention and control of viral hepatitis. As you all know, that viral hepatitis is a global health burden affecting millions of people worldwide, and Egypt has one of the highest global burden of HCV infection, with an estimated up to 10% over 8 million people between 15 and 59 years being chronically infected. And they estimated that about 150,000 new people are being infected annually, and that thousands die every year. Ladies and gentlemen, at the international level, Egypt has played a key role to draft the resolution on hepatitis, which was adopted in the World Health Assembly in its 67th session. And at the national level, we have established a national committee for control of viral hepatitis in 2006. In 2008, we launched the national program, and now we have 27 affiliated viral hepatitis treatment units distributed throughout the country, providing free or reduced cost treatment to more than 50,000 patients daily. We are looking to increase this number of patients who receive treatment. In 2014, we have launched the plan of action for prevention, care, and treatment, which focuses on the 7 main components of viral hepatitis prevention. First is surveillance, infection control, blood safety, hepatitis B virus vaccination, care and treatment, communication, and definitely research. The plan of action highlights the important goals and objectives of the hepatitis program and reflects our continuous commitment to control viral hepatitis epidemic by preventing new infections. This was a huge step towards achieving our new vision aimed at national eradication of viral hepatitis. Furthermore, we have introduced the first approved highly effective direct antiviral agent, as you know, with cure rate over 90% at 1% of its international price, and is encouraging the local manufacture of highly effective qualified generics. This would result in a greater number of Egyptians being treated and acute, resulting in decreased morbidity and mortality attributed to HCV. A web-based registration system has been established by the Ministry of Health in September 2014 to schedule patients' appointments to receive treatment at its specialized units. So far, more than 800,000 patients with known HCV infection have been registered and are being evaluated by trained experts for their eligibility to receive treatment according to the national guidelines. Patients' data are electronically recorded, and a network system connects the treatment centers to the central office based in Cairo, and currently more than 15 up to 16,000 patients have started treatment, and the number will increase by at least 10 to 15,000 more patients on a monthly basis, with an anticipated that it will treat more than 150,000 patients by the end of 2000. We are pleased to share our experience in combating viral influenza in Egypt, which in the early 90s, started in the early 90s, as we strongly believe that only collaborative efforts, information exchange at both the national and international levels will contribute to the national, regional, and global success in the fight against this virus. Thanks so much. May I invite the next
Your Excellency, Mr. Minister, first of all, thank you very much for accepting our visit in Egypt. Let me convey the thanks and greetings from our Minister personally, Dr. Sergeyenko, and on behalf of our delegation, once again, thank you very much personally and our Egyptian colleagues for this opportunity to visit this week and to spend 4 or 5 days in Egypt to get more information about your achievements and about your system on hepatitis C management. As you mentioned already, this problem is a global health problem, affecting many countries, as well as my country, Georgia. Of course, we have a little less burden of these diseases, but according to the latest our epidemiological investigation, we have also quite a high number of prevalence, 6.7% according to the investigation 2002. And in this year, we are going together with our major supporter, CDC Atlanta, to have another population-based study, and I guess end of this year we will have a more exact data about the prevalence of, but we already have quite a high number, maybe in absolute number, not like you have, because we are a small country, 4.5 million, but anyway, we have, according to the estimation, around 150,000 the infected persons in our country. That's why hepatitis C became as one of the major priority of ours. Health system, just Minister Sergeyenko, our health minister, has announced this year, 2015, as a year of hepatitis C, and we are going to create also the national plan, and it's very useful to have the information from your side, because you have already the experience 7-8 years to have a national approach and national plan on hepatitis C treatment in the country. And during these 2 days already, we had very useful meetings in Fatimia Hospital today, in the National Liver Center. We had very useful discussion with the representatives, and I'd like to thank personally Professor Manal outside. She is very kind. We had very useful, before came to Egypt, the communication teleconferences, and we planned quite precisely our visit, and all the meetings and all the information that we are receiving from your colleagues kindly are very much accepted and very useful for us. That's why one of the suggestions from our side, maybe in future, will be to establish more close contacts between because we have also the national committee now in the establishing the country. We are starting with this new approach, to use the new generation medicines, what are curable currently, particularly the sofosbuvir and this, the generation of the medicines for using, and we are expecting this medicine as well from the Gilead company in coming 2 months, and the Egypt experience already, who has since October last year introduced in Egypt these medicines, is very useful for us. You already have under the treatment, as you mentioned, around 18,000 patients, and your goal is in this year to have 200,000 and more. And of course, this, the plans for us are very useful. Once again, thank you very much for this acceptance of our visit. We have quite a large delegation here. from different, the sectors, surveillance sector, treatment sector, from the Ministry of Health, as well as from non-governmental sector. And I think during the next 2 days we will have more opportunity. And Wednesday is very important. We will have a roundtable discussion with the Egyptian, our colleagues, around all the topics. Thank you once again.
Thank you very much.
I just had a few words. Thank you very much for accepting our delegation. Well, it's a great opportunity for us to exchange our experiences in different fields, how it was correctly mentioned here. And of course, Egypt and Georgia develop bilateral cooperation in many fields, and of course the cooperation in mentioned field is very important for us, and it's going to be beneficial for both sides. Thank you very much once again. This is few words I wanted to add for that.
So thank you very much. I'm Charlotte. I'm infectious disease specialist and my favorite field is hepatitis. So thank you very much for your invitation. These days were very fruitful, so it is a pleasure for us and it was a great experience with the and I think that the next 2 weeks also, the next 2 days also will be very, very fruitful. So thank you very much.
Good afternoon, Your Excellency Minister. Thank you for having us here. My name is Chattopadhyay. I'm from the Civil Society Organization, from the Harm Reduction Network. I would like to thank you, your incredible hepatitis team, on behalf of all patients, not only from Georgia, but from across the globe. Because Egypt is an important example for us. Everyone's struggling to get an access to hepatitis treatment elsewhere. Egypt is an example to showcase that it is possible. Egypt is not a rich country. Egypt is as rich as Georgia is, so we always use the Egypt example. And thank you for that you give us opportunity to expand the access to hepatitis C treatment globally. Thank you.
Your Excellency, Excellency Ambassador of Georgia, I'd like to thank the Georgian team very much for coming to Egypt to learn from our experience and exchange experiences. And I hope this visit is going to be fruitful and we're going to sustain our collaboration together until you have your elimination model. We are contemplating an elimination model in Egypt as well, and we're going to start with small governorates, maybe some of the governorates with a small population, and we're going to upgrade and scale up all the components of the prevention or the action plan in those governorates. So I think we can also learn from your experience and what you're doing, particularly in special population groups where you have harm reduction. In Georgia, we don't have this mechanism in Egypt because they are not identified. I think most of the infected patients in Georgia are intravenous drug users. It's not the same in Egypt, it's different. But we're going to learn from your experience in these special population groups where we can at least eradicate or cure the virus in those special population groups. So thank you again, and I hope we can learn from each other much more and sustain our collaboration. Thank you very much.
Actually, we are hoping that our model in Egypt will be successful and then we will have certain parameters to be measured to assess our national strategy to combat hepatitis. I think the main reason of severe infection in Georgia is intravenous drug users. This will be to direct or shift us to direct a lot of our efforts for the topic of how we can reach the possible safe injections in general. This is one of the most important items which should be put under the infection control measures, blood safety measures, but the safe injection is a very important task to be had. We have a lot of task force should be implemented in this study. the CDC, Francesco, for us to have.
Thank you. From our side, actually Georgia and Egypt are our two biggest partners on hepatitis control globally, so it's really a pleasure to see and bring these parts of, if I can be so liberal to say, our family together. I think there's a lot of work ahead of us, but we're very excited to have an opportunity to work, particularly in Egypt and in Georgia, to help, and as Pata noted, to learn really, to take lessons that can be learned for the whole world. So I think it's a very exciting time, and I see really Egypt and Georgia now as going to be two of the countries at the forefront of hepatitis control. And so I want to congratulate and commend both countries for making this such a priority. Many countries have big burdens, but they don't address it so head-on and openly as these countries have. So it's really a model in that way too, just politically, really taking care of the people that often we call it a silent epidemic, because it's often not noted, it's quiet. People die years later quietly from cirrhosis and liver cancer and nobody thinks about it. But it's time for it to come to the surface, and I think your two countries are doing a great job in that. So thank you for that. And thank you specifically, Your Excellency, for accepting our work, and we look forward very much to collaborating.
Your Excellency, thank you very much for always giving us the example of supporting the solving of most of the tragic problems like viral hepatitis, which seems to be to have a heavy burden not only in Egypt but everywhere else. I believe what you are doing today with hosting the Georgian team and the CDC and all our colleagues from the Ministry of Health, that you are building a coalition against viral hepatitis C, which I know that you have been advocating in Geneva during the World Health Assembly, which is a kind of initiative which is much appreciated by every one of us. I believe from CDC type, and I'm wearing two hats, Egyptian hat and CDC hat. I really appreciate your readiness to support and help. And I can assure you that we will never leave any stone unturned during the first few years, and we will implement whatever endorsed in the plan of action with all partners together. Thank you very much, Your Excellency.
Yes, tomorrow they have visits, and Wednesday we're going to meet with the rest of the members of the National Committee to discuss all the briefing of the visits last week.
Thank you. Can I have all present to accept Georgia? Symbol from our archaeological Egypt is where all the country Georgia. It's a lion. It's a symbol of our. About Georgia. Some information and allow me. Thank you very much. It was a great